Okay, I'm going to show my surroundings. Okay.
Come in.
Hi, I'm Shelby. I'm going to be your student nurse today. I'm the first one here to provide privacy, bump bed, and do some hand hygiene. Can I go ahead and verify your name and date of birth, please?
Kylie Thayas, 4/11/2000.
Okay, and do you have any allergies to latex, food, environmentals, or medications?
Purple grapes.
Purple grapes? Okay, what type of reaction do you have to that?
I get a rash everywhere.
A rash everywhere? Okay. And can you tell me your age?
I'm 20.
20? Okay, and your occupation?
None.
Okay, and your marital status?
A single as a Pringle.
Single? Okay, perfect. All right. And so can you kind of explain to me what brought you in here today?
I have some knee pain.
Some knee pain? Okay. Can you give me a rundown of what happened and from when you heard it to up until what brought you into the clinic?
I was running and then I hit like a hole and my knee's been hurting ever since.
Okay. Did you fall?
No, I think I just caught myself off.
Okay. And so can you kind of point to which part of your knee is hurting?
Like right here.
Okay. And is there anything that makes it worse or better?
No, not really.
No? Are you does walking make it worse?
Not make it worse, it shows the pain's there.
Okay. And are you taking any medication for the pain?
No, not yet.
No? And how long ago did this happen?
About yesterday, I think.
Yesterday? Okay. And what type of pain is it? Is it sharp, dull, achy?
It's kind of achy.
Achy? Okay. And does it come and go or does it stay?
It comes and goes.
Comes and goes? Okay. And on a scale from 1 to 10, 10 being the worst pain you've ever felt, can you rate your pain for me?
Like a 2.
A 2? Okay. And does it prevent you from doing anything in your daily life?
So far running.
Running? Okay. All right. So I'm going to ask you some of your history. So have you ever had any measles, mumps, or chickenpox?
I had chickenpox.
Okay, and what age were you when you had those?
About 9 months.
9 months? Okay. And are you up to date with your vaccinations?
Yes.
Okay, and did you have your flu shot in the past year?
Yes, last October.
Okay, perfect. And is there any allergies to latex, food, environmentals, or medication?
Or just the purple grapes.
Okay, okay. And are your parents alive and well?
Yes.
Okay, and what ages are they?
My mom is 40 and my dad is 42.
Okay, and do your family have any history of high blood pressure, cancer, or diabetes?
Diabetes and high blood pressure on my dad's side.
On your dad's side, okay. And what is the last year of education you've completed?
I'm on my 3rd year of college.
3rd year of college, okay. And is your financials up to par for your lifestyle?
Probably not.
No? Okay. And is there any religious practices that you would like to inform me of?
I'm Christian.
You're Christian? Okay. And does it influence how I could help you or treat you?
No, not at all.
Okay. And is there any self-care behaviors that you'd like to inform me of?
I like to shower.
You like to shower? That's always a good one.
Yeah.
Okay. And can you inform me of some of your sleep patterns? How often or how long at night do you sleep?
I sleep from like 10 to like 7, so like a good 10 hours.
Okay, that's good. And do you feel rested when you wake up?
Most of the time.
Most of the time? Okay. And can you go ahead and inform me, do you partake in any street drugs, alcohol, or tobacco use?
I drink sometimes.
Okay. And when you do drink, how many times a week is it?
3 or 4.
3 or 4 times a week? And in a drinking day, how many drinks would you consume?
Maybe 2.
Okay, and if indicated, we would do a cage assessment. So I would ask, do you ever feel the need to cut down on your drinking?
No.
No? Do you get annoyed if anybody asks you about your drinking habits?
Not really.
No? Okay, and do you feel guilty about drinking?
No.
No? And do you ever need to drink in the morning as an eye-opener?
No.
No? Okay. So in the past 2 weeks, have you felt the need, and some of these questions are going to get personal, Let me know if you are uncomfortable, but this is just a routine screening.
Okay.
In the past 2 weeks, have you ever felt hopeless, depressed, or lonely?
No, not really.
No? Okay, and in the past 2 weeks, have you ever found that you are finding little pleasure in doing things?
Not really.
No? Okay, and if indicated, we would do a PHQ-9 screening, and if they indicated yes to any of the questions above, I would ask, do you ever feel like your life is not worth living?
No.
Do you have any plans on harming yourselves?
No.
No? Okay. And because domestic violence is so prominent in our society, we go ahead and ask everybody these questions. Do you feel safe at home?
Yes.
Yes? Okay. And has your partner ever punched, hit, kicked, or slapped you?
No.
No? Okay. And has your partner ever forced you into having sex?
No.
Okay. And are you afraid of your partner?
No.
No? Okay. If indicated, we would do a danger assessment. So now I'm going to assess the patient's mental status. So the patient's body is erect, their body movements are fluid, the patient's dressing is appropriate for the weather, and the patient's hygiene is up to standard. The patient is making sense, the patient is not suicidal, the patient is alert and their speech is not slurred, they are making sense, they're oriented to the time, place, and who they are. And can you go ahead and tell me the second month of the year?
February.
Okay. And can you tell me who the current president is?
Joe Biden.
Okay. All right. So now we're going to move on to vitals.
Okay.
I'm going to start by taking your pulse, okay?
Okay.
Okay. So your respirations were within normal range between 12 and 20. They were 14. And then your pulse was between normal range of 60 to 100. And your pulses were 80.
Okay.
So now I'm going to go ahead and take your temperature and your oxygen saturation. Okay, I would make sure to clean this and wipe it. Alright, can I see your index finger? I would make sure that the patient does not have any nail polish or any artificial nails on their fingers. You can go ahead and relax. Alright, and now I'm going to take your temperature, okay? If I could have you take your mask off and open your mouth and lift your tongue. Okay, and would you mind holding this for me? Alright, so your oxygen saturation is 97, which is in the normal range of 95 to 100%, so that's good. I'm going to go ahead and remove this. And your temperature is 98.9, which is in the normal range. Which is in the normal range of 96.8 to 100.4. Okay, now I'm going to start the first part of your blood pressure. Have you had any surgeries that would affect, or any medical conditions that would affect me taking your blood pressure on this arm?
No.
Okay. Do you have a preference in arms?
No.
Okay. Okay. go ahead and palpate for the brachial pulse. Do you need a pillow, or are you comfortable like this?
Oh, no, I'm okay.
Okay. Okay, I felt it go away about 120. All right, and I'm gonna let your arm rest. You can go ahead and just relax for a minute.
Okay.
I'm gonna go ahead and, is there any other pain that you would like to address with me?
Yeah, I have an ear pain.
An ear pain? Okay. And can you, is it on the inside of your ear or the outside of your ear?
It's like inside.
Inside, okay. And is it sharp, dull, achy?
Kind of dull.
Dull? Okay, and does it come and go, or is it constant?
It comes and goes. It's not constant.
Okay. And is there anything that makes it worse or better?
No.
No? Are you taking any medications?
No.
No? And on a scale from 1 to 10, 10 being the worst pain you've ever felt, can you rate your pain for me?
It's maybe a 1.
Maybe a 1? Okay,
yeah,
so
it's not too bad.
Okay. And does it affect anything in your daily life?
Not at all.
No? Okay. And so now I'm going to go ahead and finish the rest of your blood pressure, okay? Does your arm feel okay?
Yep.
Okay. Let me know if it hurts any, and I will stop, okay?
Okay.
All right, go ahead and relax your arm.
Oops.
Okay, I heard it at 120 over 78, which is in the normal limits of less than 120 over less than 80. I'm going to go ahead and remove this from you, okay? Alright. Okay, I'm going to go ahead and ask you to stand up. We're going to be weighing you.
Okay.
And would you like to see your weight? If not, we can go ahead and turn you around.
Yeah, I don't mind.
Okay, so if I can go ahead and have you stand up on here. Alright. Okay, this is saying that the patient weighs 126, but because this isn't calibrated right, the patient says that they weigh 150. And if I can go ahead and have you just step off for a second, we're going to go ahead and take your weight, or I mean your height. Okay, and if you could turn around for me. Alright. And it says 64 and a half. Oh, so sorry. Alright. And then I'm going to go ahead and measure the patient's waist circumference. And I'm going to go around the top of the iliac crest. Alright. So sorry, this is going to get a little personal.
Okay.
Here we are at 34 inches. Okay, and I'm going to go ahead and calculate the patient's BMI. Oh yes, I'm sorry. You can go ahead and sit down. I'm just going to calculate your BMI, okay?
Okay.
Okay, the BMI is 25.3. Okay, now I'm going to be starting a head to toe assessment. I'm going to start at your head and work my way down. If you feel any pain or you're uncomfortable at any point in time, just let me know, okay? Okay, so I'm going to first start by assessing the patient's head first by noting that it is proportionate to the patient's size. Do you feel any pain?
Not at all.
No? Okay, I do not know any bumps or lesions or depressions or anything in the skull. And then I am going to ask you to remove your mask for me real quick. And I'm going to ask the patient to smile. Okay, so the nasolabial folds are symmetrical as well as the corners of the mouth. And then the patient's neck is erect and in the midline. Can I have you go ahead and look to your left for me? Turn your whole head to the left and then turn your whole head to the right. Okay, now look up to the ceiling and then bring your chin to your chest and then bring your left ear to your shoulder and bring your right ear to your shoulder. Okay, I do not note any decrease in range of motion. Okay, so then now I'm going to start with your eyes. So your eyebrows are symmetrical. Your eyes are in the correct position. They are not exothalamus, which is protruding, or endothalamus, which is sunken in. Can I have you blink for me? The patient is able to shut their eyes completely. There is no redness or swelling around the lash line, and the lashes are evenly distributed. The sclera is white and glossy, and the conjunctiva is pink. I do not note any discharge. And then the patient's lips are pink with no drying. Can I have you stick your tongue out for me? Okay, I do not note any. The patient's tongue is moist. There's no lesions or anything, white patches on the tongue. And then the patient's ears are bilaterally symmetrical. I do not note any thickness or redness or swelling around the ears. The skin is intact. There's no lesions or bumps. And the hole is appropriate in size for the patient's body. And I'm going to be feeling around. Okay, let me know if you feel any pain. I'm going to do this side and then this side.
Okay.
Do you feel any pain back here?
No.
No? Any pain when I push here?
No.
No? And any pain when I move?
No.
No? Okay, and let's do this side. Any pain when I push here?
No.
Any pain when I move this?
No.
No? Any pain when I push there?
No.
No? Okay, and I do not notice any cerebrum. And then if there was any, I would note the color and texture of it. And the nose is in the midline.
I'm sorry.
Okay, and so now I'm gonna assess the hair is evenly distributed. It is smooth. It's not dry and brittle. And then I'm gonna go ahead and assess the skin.
Okay.
If I could have you pull up your sleeves for me. Okay. And is there any is there any wounds or lesions that you know of, that you're aware of, that you'd like me to inspect?
No.
No? Okay, and I would do a full skin assessment on the patient and make sure to check especially their back or areas that they cannot see. And okay, so the pigmentation of the person is appropriate for their genetic background. I'm gonna go ahead and assess for temperature. Okay, the patient is warm bilaterally. There is no hypothermia or hyperthermia. And I'm gonna go ahead and assess your nails. Can I see your hands? Okay, so the patient's nails are smooth. There is no apparent biting to the quick. I'm going to check your capillary refill.
Okay.
Okay, and the capillary refill is less than 2 seconds. And then I'm going to check for edema. Okay, I don't know any edema. If there was any, +1 is mild, +2 is moderate, +3 is deep, +4 is very deep. And then I would make sure to check edema on the legs as well. Okay, I don't note any edema on the legs. And then we're going to go ahead and do an eye assessment, okay? I'm going to have you stand up. 20 feet away from the Snellen chart, which is on this back wall over here. Okay, I'm gonna have you go ahead and close one eye or cover one eye for me. Okay, and can you go ahead and read the smallest line that you think you can read?
8.
Okay, can you go ahead and read it for me?
DEFPOTHC.
Okay, and go ahead and cover the other eye for me. And what's the smallest line you think you can read?
7.
7? Okay, can you read it for me?
FELOPVD.
All right, and can you go ahead and read them now with both eyes open?
I think it's 8. DEFPOTHC.
Okay, and the patient is not leaning forward, squinting, or anything along those lines. And if the patient was less than a 20/30 on their vision score, I would refer them to an ophthalmologist. Okay, you can go ahead and sit down for me. Okay. All right. And I'm gonna go ahead and check your hearing. Okay, so I'm gonna be rubbing my fingers together. If you go ahead and raise your hand on either whatever side you hear me on. Okay? If you'll just go ahead and look forward, I'm gonna step behind you. Okay? Okay, perfect.
It's cold.
Okay, is there any other questions you have for me?
I don't think so.
No? Okay, so I'll make sure to make note of everything and have the doctor come in and see you. I would make sure to perform hand hygiene, make sure the bed is in the lowest position, and do provide privacy.
Okay.